Good, good evening, everyone. I warmly welcome you all to Regulatory Affairs Week 5. In the previous session, we learned about evidence gaps in herbal and nutraceutical research global overview. In today's session is about case study Wheatgrass in oncology. The session is conducted by Dr. Sriharan sir. Over to you, sir. Hello.
Yeah, ma'am.
Yes.
Hi, all. Good evening to everyone. So, rewind from the yesterday class. Our yesterday class, we see about the evidence gap in herbal and nutraceutical research. In there, we look on to how, what are the evidence gap they are, how do we identify, and move on to the how to evaluate the methodological barrier. What are the major methodological barrier in in nutraceutical and herbal research, and how the regulatory frameworks are different from country to country, how the regulatory standards have different from different. Likewise we see, and at last we see about how to propose the great proposed strategy to regulatory authority or regional center. Likewise we see deep on that. So likewise today yesterday class, we are taking that connectivity to today class. So for yesterday class we see about what is herbal medicine, nutraceutical and herbal medicine evidence gap. Likewise we see. So today we are going to see about the great example of the nutraceutical and herbal product. So today our session is going to fully on a nutraceutical product. So now the today topic is case study on we are going to see about wheatgrass in case study of wheatgrass in oncology study. So our our case study should be mostly detailed on today's session is how it's wheatgrass in research focus, how it should be takes place, like by seeing how the quality of evidence available about wheatgrass and how clinical relevance evidence that supporting the wheatgrass. Likewise we are going to see deeply from upcoming slide. So today learning objective or agenda are, the first thing is yesterday class we identified the evidence gap. So but in today class we are evaluating the current evidence. So different from that is we are evaluating what are the current affair scenery evidence are hands-on wheatgrass. We are going to see on that. And next one is how this wheatgrass applicable in clinical field. Likewise we are identifying that. And also we are look onto the safety profile. We mean the safety profile is very important. When we look onto the yesterday class, they have a lack of safety profile data. So these are the major thing in nutraceutical and herbal product. So as the example of the wheatgrass, we are going to see about what are the safety profile on that. And finally we are formulating how it clinically recommend to the our clinical setting in hospital. Likewise how it clinically benefit to the patient. Likewise we are going to see on that. So short intro about wheatgrass. So it is a about wheatgrass is a it is a herbal product. So it under in the it come under the herbal and nutraceutical product. So it is biological name is Tritium astivium. So the Tritium astivium is a biological name. It called as a biological name. So wheatgrass is known as nothing as the young grass of the wheat. That is called as the wheatgrass. So look onto the botanical classification. We are now going to the bioactive component. So if you go to the bioactive component in yesterday class itself, I clearly say that one herbal plant have multiple ingredient, multiple bioactive component. So based on this bioactive component, what are the disadvantages, analytical problem may be arise. So here the wheatgrass bioactive compounds are chlorophyll and followed by superoxide dimutase enzyme, essential amino acids profile, and vitamin A, beta, carotene, and vitamin C. Likewise, the bioactive components are takes place in wheatgrass. So we are going to see deeply on that in upcoming slide. how they role in the cancer, what are their mechanism action, what are their specific role, we are going to see on that. So that is a short intro of the wheatgrass. So, what is the historical pathway of our wheatgrass in cancer study? So, in 1940 to 1950, so wheatgrass is used as a one of the herbal medicine. Likewise, traditionally they are using for all the medicine and also in cancer. So it is not especially used in the cancer. In 1940 in 50s range in the region, it not especially used in the cancer. It also used with of all other disease and also used in the cancer. Likewise, they take place in 1980 to 1990 and 1990. The first document case report and small scale studies has been done on wheatgrass on the cancer background. Cancer background is nothing but hematological malignancy. So the first case report and small scale studies are takes place in now 1980 to 1990. So before that, it is used as a there is no it should be particularly to this disease alone. No, it is used as a multiple benefit for any disease. It can be used in 1940 to 50 times, and followed by the 2000 to 2010. So there is a control studies that take place in wheatgrass. For the great example, chemotherapy induced myelotoxic study. Likewise, the studies that takes place. And after the 2010, the present 2010 to present, the wheatgrass is likewise. You before you see no bioactive compound, his bioactive compound chlorophyll and super dioxide enzyme. Likewise, these enzyme based upon this enzyme, they expand the research to their property, likewise antioxidant property, anti-inflammatory effect, nutritional support. Likewise, they're expanding their benefit. So that is the present 2010 research state, 2010 to present research status. So methodological framework. So yesterday, connect with yesterday class, there is a major methodological barrier takes place. First thing is variability, raw material variability. Likewise, raw material availability, extracts and unknown of the magnetic mechanism of one. Likewise, there should be a lot of drawback on that. So today we are going to see about how the this evidence will back from the apart from the yesterday study. We are going to see about that. So in our literature first we going to in a literature search strategy. So the the mostly search strategy are database about PubMed, MPACE, Cochrane library. Likewise, this is the focusing. We want to go to the literature search strategy in based upon the keyword is wheatgrass, cancer, oncology, chemotherapy, radiation therapy. Likewise, you want to if you want to go to search, like in first session itself we deeply see on the how to search in PubMed, how to search in database. We are clearly seen on that. Based upon that, you want to do the literature search strategy. And another thing is study selection criteria. So this is very important. So your inclusion of the study is mostly important. So your mostly the nutraceutical study, you all know about that. So mostly they are observational study, case series study, pilot study. Likewise, they are limited in control study. Likewise, you want to include on that, and also you want to exclude what means in vitro study. In vitro study is nothing but animal study, animal model study. Likewise, if you want to know deeply on that, why means it will not give benefit to in a real clinical work. So it will act as a supporting document, but there is no evidence, highly evidence on the human testing is very low. So you want to exclude the vitro studies like animal model study. So this is the study selection criteria of the wheatgrass. So another thing is quality assessment. Quality assessment is very very important. In this quality assessment, we are evaluating the patient, how to select them. We are evaluating that. So the new Castle Ottawa scale. So this is a important scale. Why I am saying means this scale used to access in quality and risk bias. So this scale, while we are doing mostly the nutraceutical herbal product, mostly they are non-RCT. Non-RCT means nothing but they not follow the randomized control trial. So they are mostly are in observational study alone. So you want to give the quality of the study to them. So if you want to give the quality means you want to evaluate their study. So this is the one of the important scale, Newcastle outcome scale. So this scale access the quality of our study and the risk of our bias. These are the things that takes place. So mainly this newscast O2 scale mainly used for COGAT, cross-sectional, systematic study, meta-analysis. Likewise, we are using. Why we are using this scale means to include the patient in our study. So that kind of the point of view also we are using that. So this scale is based upon up to 9 point. So followed by 0 to 9. So 0 to 3 indicate high. They have high co-founding selection bias takes place. So 4 to 6 have moderate selection bias, confounding likewise. So 7 to 9 is a very best while we selecting the patient. Why I am saying means in 7 to 9 alone, low risk of bias, high quality takes place. So this is the quality assessment in Newcastle or Ottawa scale observation. Then followed by another scale is having Cochrane risk of bias scale. So this Cochrane risk of bias scale is majorly used for RCT. So Newcastle Ottawa scale majorly used for non-RCT, that is observational study. But Cochrane risk of bias tool mostly used for the RCT side. It is one of the gold standard tool. They are mostly currently using tool. So what are these tool specifications are? They prevent the selection bias. They prevent the missing outcome. They measure the outcome and they avoid the reporting bias. Likewise, it will take. So it is also in a color. It should be in a color demonstration. In newscaster Ottawa scale, it should be in a scale line from the 0 to 9. But in Cochrane risk of bias tool is indicator of colors. So the green, yellow, red. So you green know, you may know green is a good signal. So there is a low in low risk, low bias. Yellow is moderate risk, moderate co-funding likewise. Red is high risk, high co-funding. Likewise, they are evaluating. So while we get to the patient in the study or you are evaluating the study, these two skills are very important to analyzing the evaluating that. So while we doing the meta-analysis or systematic review as a your final year student or as a your working professional means these skills play a major role while we doing the research, while we doing writing meta-analysis on a nutraceutical product. So this is the study identification result. So there has been a case report of high region followed by the case period, COGA study, pilot study, cross-section study. Likewise, this showing the what type of observational study have high range. They indicating that. So primary cancer study, how the nutraceutical or product or wheatgrass involved in primary cancer study. So these wheatgrass have 45% studies on hematological based study like acute leukemia, lymphoma, myeloma. Likewise, they are taking major roles in hematological area wheatgrass, and followed by the hematological breast cancer. Breast cancer, they take the 23% of the study takes place in wheatgrass, and they the focus treatment related toxicity. Likewise, they take a major role, and followed by the gastrointestinal. Likewise, colorectal cancer, pancreatic cancer, the 80% studies have in wheatgrass, and other solid tumors like neck cancer, tongue cancer. Likewise, they have a 14% of the study. This is a percentage of the studies in wheatgrass. So now we are going to see about the landmark study, myelotoxicity in breast cancer. So this study is demonstrate the how wheatgrass is utility as a supportive treatment. You want to consider one thing. So any drug, it's not claiming that it is a alternate treatment for the drug. It is alternate treatment for the chemotherapy, radiation. Nothing, any herbal or nutraceutical products are claiming. So that is look onto the wrong manner in the study. So the any wheatgrass or any neem or turmeric, they act as a supportive therapy. So this study is demonstrating how wheatgrass is utility as a supportive study or supportive care in oncology. So it is take place in randomized pilot study. I'm saying the very important things on this study. What this means? So The neutropenia is very important. You all may know about the neutropenia value. It is in CBT count level. So if it is increased, means it is very dangerous. So we want to control the neutropenia while in treatment of the of the cancer patient. So the standard chemotherapy have a neutropenia count reduction is takes place is a useful. So here our primary endpoint is we are going to take place the severity of myelotoxicity and duration. And secondary endpoint is nothing but the quality of life. How the patient quality of life improve, the treatment delay or how the treatment delay and the dose modification. We are going to see about the secondary endpoint. So our study key findings are it saw the after after the consume of nutraceutical product like wheatgrass likewise, it saw the reduction in neutropenia severity. So it's showing, and it also decreased the growth factor support need for growth. So it have a limitation in growth factor support, but it simultaneously it decreased the neutropenia severity. So our second likewise our secondary endpoint here showing the no treatment delay in wheatgrass group in 23%. So the treatment delay also very low while we given to the wheatgrass going group apart from the non-wheatgrass group. So this is the great example of the study. So this study decreased the granulocyte stimulating factor. So there is no treatment delay on the patient who are taking the wheatgrass. So this is one of the benchmark trial study that prove the wheatgrass have less side effect, and it also act as a adjuvant therapy. Likewise, it takes place. This is a landmark study. So followed by the another studies are hematological malignance. What are the evidence base means? How the wheatgrass takes place in acute leukemia study and lymphoma investigation and multiple myeloma observation. These are all likewise we before see that the hematological studies are 45% studies that takes place. So these studies are telling about how in acute leukemia study you take means they are takes place in a cohort study. In cohort study they are demonstrating the infection rate. You are the primary point is infection rate, and secondary is a reduce of hospitalization and reduce of induction chemotherapy. Here the wheatgrass play the important role reducing that. Likewise lymphoma investigation, it is also case series. It is acute lymphoma studies cohort study. It is a case series study analyzing the 34 patient. Based upon that, it's showing severity in mucositis. So and improvement nutritional status. So this multiple myeloma observation study is also retrospective study. You know what is retrospective study? It taking from the past history or past data of medical data of on the patient. So these are the great evidence based study. While the wheatgrass play how the clinical role in the patient. Likewise, this is the example for that. So mechanism of action. So yesterday itself we see the methodological barrier. First thing is, and in evident gap. First thing is magnetic. So mechanism MOA action, lack of MOA action. So if you see the drug means we have the top to bottom history of the drug, the mechanism of action, side effect, PK, PD, what is side effect, initial dose, likewise. So in nutraceutical product there should be a lack on that. So apart from that we have a evidence on the current understanding of the wheatgrass how they are using. So first thing is antioxidant activity. It has an antioxidant activity. Why means it have a bioactive compound like superoxide metose and catalase enzyme act as an antioxidant activity in the patient. It is not very helpful for the cancer patient. And DNA production. So in DNA production is very important. Why means chlorophyll. You know chlorophyll. It is also one of the bioactive compound in the wheatgrass. So it repair the DNA pathway. So the chlorophyll main MO is it repair the chlorophyll DNA pathway and help the body to detoxifying the cancer targeting area. So cancer targeting area is nothing but carcinogenic area. It detoxifying that. So the chlorophyll play major role. So apart from the chlorophyll, we come to the last point is hematopoietic support. So hematopoietic support is nothing but the anti-inflammatory property. Where before we see the antioxidant property, DNA production property. So hematopoietic property is an anti-inflammatory property. So in wheatgrass have several phytochemical property. So likewise from the bioactive compound it have some phytochemical property. So it will reduce the inflammatory in the cytokines. So it will reduce the inflammatory and cytokine. It is very useful for the cancer patient for the immune modulating. So immune modulating it is play very important role. Likewise the cancer patient have fatigue, the skin inflammation, likewise they will experience. So using that we can get benefit from that. And apart from the antioxidant, DNA production, hemopoietic support, nutritional malabsorption takes place. Why I'm saying means due to their condition, nausea, vomiting, they have a poor nutritional status. So here the bioactive compound we have vitamin E, vitamin C. It will help the patient for healing and recovery very fastly. While we taking that means the healing period is very fast. Apart from the recovery period also very fast. So this is the dosing protocol in clinical study. So when we look onto the herbal and nutraceutical product have, there is no proper dosing protocol in clinical study, lack of on that. But in wheatgrass there have a standard daily dose which should be in 60 ml. So here they are also include the treatment duration also. There should be a 21 days. If you see the last class or before class or first class means, if you see on the nutraceutical product means they have a major lack in this area. So it means they have no standard dose. We know how long to take, when to discontinue, when to relapse. We don't know what is the frequency. We know no adherence rate. We know no. So this is clearly saying that wheatgrass have a 21 days treatment duration, and it will be taken twice in a day, and it have a patient have 80%, 85% have adherence rate. So this is the dosing protocol in clinical study. So quality of the life improvement. So fatigue is a major thing, and followed by the appetite, sleep quality, and nausea control, physical foundation. The wheatgrass play an important role in controlling that. So this is the quality of life outcome. So it is also act as a secondary endpoint. So likewise, I before say that nutritional support evidence. Why means in cancer patient we need a nutritional support. Why means they have a low value of nutritional benefit and nutritional support due to their taking medicine, chemotherapy, radiation, nausea, vomiting. Likewise, their major side effect. So we want to control that, we want to overcome that. So in that part wheatgrass play major role. Wheatgrass play major role. They have a nutrition supporting profile on that. So what the micronutrition profile is, in wheatgrass they have iron content, magnesium, potassium, zinc. These contents are takes place in wheatgrass from the source, from the bioactive compound like vitamin A, vitamin C. So it acts as a nutritional supportive evidence also. In clinical based we see means so should be a three study takes place about the nutritional status changes in cancer patient after taking the wheatgrass supplement. There has been three studies are registered on that. So in this study they saying means, what they are saying means the cancer patient have malnutrition and nutrition depletion. These are the common challenges. Due to that alone, the patient have weight losses take place during the chemotherapy or study. So this study saying that after taking this, that the serum albumin level is same in normal as a normal individual versus cancer patient. They maintaining the same, and they also reducing the weight loss. So it is also takes place in clinical nutritional outcome also. We have also evidence on that. So chemotherapy induced nausea management. So if you know, the chemotherapy is the major and the main side effect is nausea. Induced nausea is a major thing it will cause. So acute nausea, delay nausea, anti-emetic sparing. These are the stages. How the nausea or how it will be delivered through the chemotherapy stage. It will deliver. So Using that, it can reduce the acute nausea level and delay nausea level. Apart from the antiemetic drug sparing, it also play wheatgrass also play major role in delivering on that. That is the value of showing that here. So mucositis prevention and management. Why mucositis is nothing but if we are taking the very powerful drug in simple language, I'm saying means a cancer patient man took the powerful medicine also. They go for chemotherapy also. They go for radiation also. So due to that, they have painful inflammation in the mouth. That is ulceration. Ulcer in mouth. In simple language, we know no ulcer in mouth. You many of may experience if you not eat well in morning, or if you are skipping morning meal, mean the mouth ulceration will be happen. Those who are having the history of ulceration means the frequently the mouth ulcer will become. So the cancer patient also it will come. So they are classifying them into two grade ones are moderate, mild to moderate, and here the two stages severe mucolitis. Grade 3 to 4 is a severe mucolitis. While giving the wheatgrass, it gradually decreasing the healing, and it healing time is very low, and it also gradually decreasing. So this is the one of the important thing while the cancer patients are experiencing. First thing is nausea, and second thing is mucositis. So it wheatgrass also show good effect and good evidence on that, showing benefit in the while the patient having the cancer treatment or like chemotherapy or radiation. It's showing the great effect on that. So radiation therapy application. So and we see on that chemotherapy, drug therapy. Now we are moved to the radiation. So radiation is another type of the cancer study, cancer treatment. So it is also one of the part on that. So it also act in a radioactive property, and it also useful for the dermatitis management. Wheatgrass also, and fatigue medication also it is avoiding that. So wheatgrass are showing a very effective evidence on that. But in radio producting profile, the most of the studies are in preclinical evidence. So there should be a lack in a human study. So that is only the drawback and the the radio productive property. So we want to do more on that. So there is a low evidence in the human data. So dermatitis management, it reduce the dermatitis in while the breast cancer patient have frequent on that. So it also reducing level on that. So fatigue medication, while consuming the daily wheat get, it also showed in less in fatigue score also. So this is the application of the wheatgrass in radiation therapy. So safety profile analysis. So safety profile is very important thing. Based upon the safety profile alone give the way to the bioequivalence, give the way to the bio compatibility, give the way to the adverse drug side effect. Likewise, so safety profiling is very important. So herbal and nutraceutical products have lack on the safety profile analysis. So here the wheatgrass showing a good safety profile analysis. So the ADR event rate is 0.8 percentage alone. So they have a less ADR event rate, and serious adverse event is there is no reported till now the serious of adverse event. So discontinuous rate, the discontinue rate is also very low, 2.1 percentage alone. So due to their taste preference alone, the maximum patients are discontinuing. So this is the safety profile. So drug interaction and consideration. So it's nothing but herbal drug interaction. So in herbal drug interaction, likewise we have a low profile, we have a low data on that. There's no highly evidence to develop on the likewise micromedax. Likewise yesterday class, the drugs have micromedax. Easily we can after putting the drug, we easily can we get the result. Wow, what should be avoided concurrent use, what should be alternate use, what should be monitored during giving this drug. So these are the things in drug, but in herbal product there have been a lack on that. But in wheatgrass they are showing a significant analysis on that. So anticoagulant interaction, why here anticoagulant interaction, you want to think that. So if you go to the first slide, his bioactive compound is chlorophyll. So if you go to the chlorophyll have a great action in DNA path repair, but they have a high vitamin K content. So wheatgrass have a in chlorophyll's main important thing. So they have a high vitamin K content. So it will cause some interaction of that. So there is still no clinical case reported. There is no clinical case reporter or review. So we want to consider while we taking the anticoagulant medicine like warfarin, like we are taking means we want to consider that, or we want to monitor the INR value while taking the wheatgrass. So chemotherapy interaction. So here also there is no document pharmacokinetic profile interaction while in chemotherapy stages. So, but in antioxidant activity likely can be interfere with that. So due to it has an antioxidant property, wheatgrass also you know about that. So some oxidative stress it will make antioxidant activity will make some oxidative stress which will affect the chemotherapy. So that is a chemotherapy interaction. The immunosuppression agent is nothing but we are taking that it will alter our therapy effect. You know the therapy what it mean by therapy effect. It will alter. It will give the decrease or increase. It will decrease the concentration. Likewise, it will in immunosuppressive agent. It will alter the their therapeutic effect on that. So patient selection criteria. So likewise, before you go to the first slide itself, how do we want to evaluate the patient? How do we want to select that in study? Newcastle O2 scale, and another thing is in Cochrane risk of bias. That is mostly used in RCT. This is mostly used in our observational study or RCT. So Newcastle O2 scale is very important to evaluating. So likewise, we are evaluating selecting person based upon their performance in of for EC ECO0. So ECO002 is one of the tool evaluating the perform tests. So it is nothing but Eastern Cooperative Oncology Group score. It is also one of type of the score. So based upon the score we are selecting, and they have adequate GA function. Why means the wheatgrass have a rapid absorption rate. It has high absorption rate. So if the patient have a inadequate GA function, mean it will affect the patient functions also. So that is, and another third thing is no history of allergy on grass. If some patient have allergy of grass, mean they not intake that. So we want to avoid that. So motivated for complementary intervention. Likewise we are taking. So stable anticoagulation state, anticoagulation status. Why means in a before slide itself we see that they have a anticoagulants interaction. So we want to have a stable INR value on the patient. Then alone we want to include that. If we include the INR value very low or moderate, means it will affect the study also. It affect the patient. It will risk to major serious risk to the patient. So we want to consider this is the appropriate candidate. So what are the contraindication? This is very important thing. So likewise, severe mucositis grade 3 to 4 patients should be avoided. Why means they have gluten tolerance have high. So here the young wheatgrass have a gluten activity. Have gluten is one of the component. It have a high activity, so it will affect the patient. So that is one thing. And another one thing is unstable diabetics. So there should be controlled diabetes is very needed. So why means it uncontrolled diabetes, it will impact on the wheatgrass study. Why means wheatgrass also some may they will put some sweetening agent. Likewise for their tolerance they are putting. So unstable diabetes patient also we want to avoid that. So this is the relative contraindication will be considered the patient. So in safety concerns we want to main thing is proper storage. Proper storage is main thing. So we go deeply see on that. So preparation and administration method. So in preparation administration method, the source of selection, why we are taking the source of selection, you want to consider from the before class. Why means there should be a raw material variability because to the climatic changes, season likewise. So select the correct source from getting the wheatgrass. That is very important. Then alone we get the constant, avoid the variability, and the source of selection is important. Extraction method. So extraction method, we itself extracting, that's like simple, using mixie, or likewise we are extracting them using our juice maker. Likewise we are extracting that. So if you consume the fresh juice within a 15 minutes means it is very useful. Why means the lot of bioactive compound have active manner while we eating the fresh juice. If you eating the storage fruit after the 48 to 24 hours is not advisable. Why means there should be a microbial contamination takes place. Likewise, the severe things are happen. So you take before 24 hours. Mostly avoid the storage, because why you are taking storage means that is, likewise before seasons, right? The wheat grass have a two times a day, two frequency. So morning, evening, we want to take. So for the basis of taking evening alone, we are storing the wheatgrass. So that is one of the thing. And quality assurance. Likewise, I'm before say that microbial testing. Why means there should be a microbial contamination takes place. It will alter the immunocompression patient. Likewise, storage guidelines should be also guided to the patient. There should be refrigerated maximum 24 hours. Apart from the 24 hours, it should be not advisable, should be avoided. So this is the preparation and administration of wheatgrass. So economic consideration, how is costly benefit, how cost benefit, how it is economically available to the patient. So monthly cost is euro 45,000 alone, and home growing it will compound on the 18 euro, and healthcare saving 14 percentage it will reduction, and cost benefit ratio is showing 3:1. So if you want to see only the main core thing, what is this mean? Wheat grass are available in our country. It is a traditional essential use. It is very cheap on the rate also. So based upon that, our monthly cost is very low. While we growing the homegrown, it also very low, and it also saving the healthcare as a supportive therapy. It also reduce your treatment expensive to more on the other drug rather than. So our cost benefit ratio will be evaluating that. It also show the good effect on that. So this is the economical consideration. So regulatory and legal framework. Likewise, yesterday class itself we see about the regulatory framework. So UK, US, they are recognizing the wheatgrass as a supplement, and how they are no prescription is required. They recommend for the cancer patient. In FTA status, also they are considered as a supplement alone. So while we going to the deep on while getting the monograph on that, are you doing any serious research on that means alone, we want to have a clinical claim data on that. So clinical integration. So in clinical integration is institutional policy. So what is institutional policy means, if you, for example, I'm saying means there should be all the hospital, likewise Apollo hospital, another major hospital, Meenakshi Mission hospital. Likewise, I'm saying from Tamil Nadu, Meenakshi Mission hospital, MGM hospital. Likewise, all about Apollo hospital. So they have a different institutional policy. So they have a different guidelines. They have a different formulary. So that is clinical integration. So maybe vary, and based upon their policy, it should be vary on that. So that is a clinical integration. So here we are going to see about, yesterday we see about what is the limitation on whole nutraceutical and herbal product. Today we are seeing that what is the limitation of current evidence of the wheatgrass. So first thing is study design weakness. So that study design weakness, you may know about that. There is a law about limited in the randomized control studies. That is one thing. So heterogeneous population is nothing but need generous ability. So while doing a small population in a small area means we cannot attain to broader population to claim this result. So that is a heterogeneous population. And outcome measure, yesterday class itself I clearly tell about what is outcome. Your outcome should be in a clinical relevance and clinical endpoint plus PRO, patient reported outcome. You want to correlate with another. So that based upon that alone, you will give the power pack tempo. So the inconsistent endpoint will lead to the drawback in the result. So outcome measurement, duration and follow up. Why means the most of the studies have low duration, a low duration and the low follow-up. Mostly we see on the yesterday class, but itself acute, chronic, and long-term. The most of the studies are 1 year, 1.2 years allowed. So there is there is a lack in long-term follow-ups. That is a limitation. So comparative analysis with other product, we are analyzing the wheatgrass with another other product. So in clinical application, wheatgrass have a excellent in myelotoxicity, while we are taking turmeric have a good in inflammation and neuropathy application, and green tea have a high and good profile in preventing antioxidant agent. Likewise, this is the example for that how the product are giving the clinical application on that. So this is the example apart from the wheatgrass. So now we are going to see about a case study. Case study on that. There should be a four case study on that. So first case study is acute lymphoblastic leukemia. So here acute lymphoblastic leukemia in wheatgrass. The what is major role is, I'm simply saying that what is the wheatgrass role is. While intaking the wheatgrass, there should be a fast recovery and there should be a reduction reduce in neutrophil counts. So that is saying in that. So here the study is 16 weeks active compound. The monitoring level is weekly. They are monitoring FVC, LFT, and toxicity assessment. They are monitoring. So the outcome, like I said before, say they reduce the neutrophil count. So neutrophil count is major role. So the wheatgrass showing a good effect on that. So that is the case study example of on the lymphoblastic leukemia study. So another thing is pediatric oncology consideration. Likewise, before I'm say the class, there should be a limitation in pediatric and pregnancy and lactation woman. So geriatric population also due to the polypharmacy. So likewise in pediatric oncology consideration, the limited in pediatric data. So there should be only 3 cases has been reported due to there should be league ethical issue or why means it have a palatability issues. Likewise they have a limited in pediatric data, so that likewise palatability challenges, so the taste acceptance. So this is also one of the important thing. And developing consideration, while we giving to adult child, likewise 14 or 15 age or 16 likewise age, they are showing a good benefit, but monitoring parameter is very important. So we did not know the full history and the full PK or bioequivalent data. Based upon the before study, based upon the other study alone, we are getting the data. So that is a development consideration. That is one of the concept on that. So PRO, patient outcome report. This is the example of their report. How the patients are saying the breast cancer, the patient delivering that. They noticed the improvement in their energy level in first week itself. While taking the wheatgrass, they have show the energy level, and nausea also have become less. So they are and their nutritional status also have better. So this is the breast cancer patient age 52. Likewise, lymphoma patient age 32. So their taste took some getting to used to benefit variety. So taste, they are saying taste is a drawback, but apart from the taste, it will give the benefit to us. Likewise, they are saying, and the blood count is nothing but neutropenia counts have faster recovering stage takes place. So if they felt good benefit on their treatment while taking the wheatgrass, they are delivering it. So another one is acute leukemia patient age 90. So they are saying their oncologist suggests this to supporting treatment. So while taking that, also they also decrease the treatment delay. So they also give the gradually effect and benefit on the treatment. So this is the PRO reported outcome of our wheatgrass study case study. So healthcare provider perspective. So here we are going to see about the healthcare provider perspective. So here in the oncology survey result, there should be a 68 percentage aware of the wheatgrass research. So healthcare know about 68 percentage. So there should be a wheatgrass. It's showing some or some not major effect supportive care in cancer research. Likewise, they are aware on that, and they have 34 percentage have comfortably used. Apart from the palatability challenge test, the 34% have comfortable on using that. And 89 request notification of use. So 89% have a request notification of their use. They are requesting notification they are using. Likewise, 89 percentage have a request notification on that, and 45 percentage should be considered as a formal recommendation. Formal recommendation, usually they are recommending formal recommendation for the wheatgrass. Well, the cancer patient, they are formally recommending that you, if you take it means you will get the good effect on that. Likewise, they are formally recommended that. So barrier, what is barrier means the one main thing is insufficient data. So insufficient evidence base, standardization issue. So if we have a standardization issue, like a storage problem occur, likewise that is the major implementation. So we want to correct on that. So supporting power, they have an excellent safety profile. Y means 0.8 percentage ADR. That is also not should be in clinical report. 0 percentage of the serious adverse event report. Likewise, so nursing perspective and practical implementation. So here the healthcare role is very important. How the healthcare role play important role in implementing these things. Why I mean first thing is patient education role. So nurse serve as a patient education role, and clinical pharmacologist also nowadays they are also playing major role in patient education. So first of all, we want to educate the person how to take the drug, how to store it, how to preparation. Likewise, we want to educate the person. So in proper education give the good result on our study. So education is the first thing. Another one is symptom monitoring. You want to consistently monitor their symptoms. So how their symptom is while taking this, any drawbacks are coming, any side effect are coming, which will useful for analyzing the safety profile, also analyzing the bioequivalence data, also drug interaction. You can easily catch the what while monitoring the symptom monitoring, you can easily catch that error on that. So symptom monitoring very important. Integration challenge. So integration challenge is nothing but storage requirement, preparation times. Yeah. So likewise, we want to educate the person. Why means they simply they will take the preparation of 2 day before wheatgrass. So that will give the microbial contamination. They maybe no, we only refrigerate in fridge, so it will it will not affect our health. Likewise, they will think. So that is the integration challenges. You also want to overcome and based upon patient education role. If you done in a perfect manner, the integration challenge should be avoided. So quality standardization issue. So I mean, yeah, it has a standardization issue due to the raw material variability. Likewise, it have a standardization issue, product variability, testing standard. It have a lack testing standard. So regulatory framework, absence of their active presence in regulatory framework, and clinical grade requirement. There should be a no grade pharmaceutical grade on that. So this is the quality standard issue in the wheatgrass. Or it means if you overcome this, mean now they giving the evidence on that. While we overcome these quality standardization issue, mean it will give the great evidence, and it also sign in a global market. While we doing the research, it will give the good result while we overcome the quality standard issue. So future research priorities. Likewise, mechanistic study, we want to do more mechanistic study and mechanism action, how their paths. Likewise, here we want to know the cellular paths, protein binding, how they're binding, how it affect the lipoprotein level. Likewise, we want to see. And the large scale RCT, we want to say biomarker development. So here the biomarker development is developing using proteomic genetic profile. Likewise, we want to develop the biomarker, long-term safety vision model, and formulation research. Why means if you overcome the quality standardization issue, the formulation research is very important. So if you achieve the formulation research, it will give it will give a steady state in safety profile, also and PK level, also formulation research. And health economic, we know it should be a cost effectiveness alone. So potential mechanisms are, so what is this is potential mechanism. They have antioxidant defenses, DNA repair pathway. Likewise, chlorophyll they have a DNA repair pathway, immune modulation, anti-inflammatory. So this is the potential mechanism that takes place in cellular level. How the bioactive compound actively takes place in a cellular level. Likewise, before we before slide itself, we see the what is antioxidant, how the anti-inflammatory effects. So in the majorly shown for the radiation people, they may have a skin irritation, dermatitis. Likewise, will happen. So this is the potential mechanism in cellular level. So bioavailability and pharmacokinetic. So likewise, bioavailability. So it has a rapid absorption rate. So it has a rapid absorption rate takes place. So while we giving the other drug or taking other drug, it will affect the other drug also simultaneously. So that is one of the limitation on that. Another one thing is chlorophyll. So chlorophyll have a 4 to 6 hours with the peak concentration is 90 minutes. So it also you want to consider the metabolic area also. So enzyme activity. So enzyme activity is elevation in 8 to 12 hours. So alone we are giving the dose in a 2 times manner, 2x manner. So means the elevation level is up to 8 to 12 hours. So our there are elevation is nothing but half-life period. So 8 to 12 hours. So this is the absorption characteristics and the factor affecting bioavailability. So if the patient have a low gastric acidity means they will enhance the absorption, the food drug interaction. Mostly you want to take the wheatgrass in an empty stomach. Why means if it has a fast absorption rate. While we take with the food, it will alter that. So food drug interaction will also take. So processing method. So take the fresh juice apart from the powder. Why means it will have active ingredient on that. Apart from the powder, it will act active on that. So that is the factor affecting biology. Storaging time, you will all know about. You want to follow the guideline storage. Take the fresh juice, not apart from the 24 hours. Within a 24 hours itself, you want to say that. So, individual variation due to the raw material variability, individual variation also takes place. It should be difference in threefold difference in the plasma level for the individual patient. So integration with the standard oncology care. How we integration? First of all, initial assessment. We want to while we giving the wheatgrass as a supportive treatment, supportive care. Initial plan is we want to know likewise performance status using before itself we see about ECOG. ECOG is nothing but Eastern Cooperative Oncology Group Score. Likewise, we are based upon the group score, we want to select the performance status of the patient and we want to put the treatment plan. What are the contraindication? Before gluten concentration, it have a high in wheatgrass. So we want to consider the contraindication. The low gastric pH level should be avoided. We want to take that. So it is an initial assessment. After initial assessment, we want to give a team discussion. Want to discussion with chief doctors, nursing aide, clinical pharmacologist, nutritionist. Likewise, we want to team discussion. After team discussion, we want to give the patient education about it. The healthcare role may play major role. Nursing or clinical pharmacologist. Why means if you success in patient education, the result will be seem to be good. So patient education and ongoing monitoring. So after your patient education, ongoing monitor. Why means in ongoing monitor alone, we can analyze the symptom level. We will analyze their treatment level, how the symptoms work, how the symptom decrease, where the symptom increasing. Likewise, we can integrate. So this is the actual plan. How first is initial assessment, step 2 is team discussion, step 3 is patient education, and step 4 is ongoing monitoring. So international perspective and practice variation. So how the wheatgrass in international global database, how they are practicing that. So European practice, they are also practicing, they are also taking the research on wheatgrass in the several cancer center as a supportive therapy. So that is a European practice. So North America also, they are doing cancer research. The MD Anderson is one of the most famous hospital for the cancer curing. It has a high success rate while curing the cancer care in a global data, in a global level, international level hospital. So they are also doing the research on that. And Asian adaptation, likewise, our India, Japan, they have a high traditional essentiality of the wheatgrass. So they are also doing, but they have some quality control challenges, likewise before I'm say, due to the climatic changes, geographical location. So this is the international perspective of the wheatgrass practice. So clinical decision making framework. So based upon that, we want to give the clinical decision making framework, whether the wheat classes should be recommended for the strong, whether we want to recommend moderate, whether we want to given by the case by case evaluation. Generally not recommended. Strong recommended, you may know hematological study, they majorly use in breast cancer, so strong recommendation takes place. Moderate consideration due to have some stress oxidizing error while we giving the wheatgrass. Likewise they will alter the immunosuppression. Likewise we want to consider the while a radiation therapy patient, we want to consider moderate. Case by case evaluations, nothing but some patient have experience about allergy on that, some patient have contraindicated, likewise gluten contraindication, likewise they have. So we want to give the case by case evaluation while prescribe, while giving the wheatgrass. And generally not recommended while the patient have low GI level, they have a severe mucositis. So that kind of the person we have generally not recommended. So this is the clinical decision framework. So monitor and assessment protocol. So in here, integration lesson, ongoing monitor or monitoring. So monitoring assessment is very important. So if we want to monitor the CBC, why means there should be a neutropenia count takes place. We want to monitor the CBC and liver function test also we want to monitor. Why means based upon that we can use as a future as a renal impairment cases. Likewise we can use on that using bilirubin, albumin. Likewise, we can use on that. And quality of life score is very important. It has as a secondary endpoint. We've also add as an optional thing. So it also you give add on to our study. And nutritional status, very important thing. Nutritional status. They have a poor nutritional status. We want to monitor that after the and toxicity assessment. We want to access assessment. Oh, it means the toxicity data is very low. If you access mean, it will give the weightage to the study. So this is the monitoring assessment protocol. So cost effectiveness analysis. So while taking this supportive care, it's showing 23% they have reduced hospitalization and the care supportive care drug cost is very low. So their maintenance therapy intensity means due to the treatment delay, the dose fewer dose reduction, it also should be in a control reduced in 31%. So this data showing that the patient how while taking that how they utilizing through the cost benefit manner and their economical cost and economical manner. So hospitalization, lowering cost, and maintaining the treatment intensity. So that is the main focus on that. So what is the barrier? So barrier is financial barrier. So this is financial barrier. Why I'm saying means in wheatgrass have there should be no claim on that. So some insurance company have a limitation for wheatgrass coverage. So that is a financial barrier, knowledge gap due to the lack of clinician education, lack of real world clinicary decision setting. Likewise, we have no, the doctor have likewise, in herbal medicine, you take means doctor have no confidence to prescribe that. Why they no confidence? Also, I'm saying why means we have no strong data on that. So based on the data alone, will doctors or any chief doctors will be prescribed. So lack of data we can prescribe mean it will give the serious effect to the patient population. So the knowledge gap, institutional policy. So the different likewise before I said different institution follow the different policy. So Apollo follow the different procedure. Another big hospital follow the different procedure. Will be giving the wheatgrass. So the policy, institutional policy. So quality assurance recommendation. Likewise, your source verification is main thing. If you select the correct source, you will avoid the raw material variability and main thing is raw material variability. So you can avoid that pesticides residues. You can avoid. Uh, while you get from the good source. And patient education, and educating patient is very important. How to take, how to prepare, when to take and when to not take, how long it should be preserved. These are the things should be patient. And storage protocol, how long, likewise it should be maximum 24 hours. After 24 hours it's not advisable. You want to take the twice a day, so alone we are taking. Likewise you want to give the recommendation on that, how to handle and how to take care of that. So research methodology recommendation, likewise primary endpoint. Here the primary endpoint. So your primary endpoint should be in a meaningful on the clinical treatment meaningful. Likewise, you take your primary endpoint should be fully focused on clinical input. For example, how the treatment rate is decreased while taking the Wheatgrass is a primary endpoint. Secondary endpoint is how it reduced the hospitalization, how it reduced the cost. Likewise, you can take. So primary endpoint is patient stratification. So patient stratification is if you're taking the breast cancer means you want to stratify the patient into subclass. If you subclass means we can get the more detail on that. Example, HERS positive to likewise, we have HERS positive to triple negative patient. Likewise, there should be a subclass we want to do that. Yes, in first class observational study itself, we deeply see on how to stratify the patient, how to stratify the patient in the research. So if you stratify the patient, mean we will get the more detail on the subclass group also. It will also very useful for the giving personalized medicine on that. And follow-up duration, we want to give the long follow-up duration, so lack of follow-up duration also overcome on that. So ethical consideration, so inform consent form element. So in normal drug means we have a quality of evidence, what should be our procedure, what should be our standardization issue, SOP. Main thing is SOP we have, but in herbal medicine there should be a lack on that. So means we have a lack of current evidence and lack of thing on that. So that is the one thing, or major concern in the informed consent form element. So while we doing in herbal medicine, apart from the drug, we want to clearly explain on that. Why means we have a low data quality, low clinical evidence. So your claim is very important to the patient. Your guide is very important to the patient. Based upon that alone, patient follow that. So you also want to include on that informed consent form. So personal responsibilities, nothing but building getting the gaining the clinical evidence through the strong monitoring, strong accessing, and following the protocol and following the guidelines, creating the SOP. That is the professional responsibility. And analyzing the data, and maintaining the SAP, and maintaining the data quality, and analyzing the missing data. Likewise, that is a personal professional responsibility. So patient communication strategy, it is divided into three parts. Initial discussion, based upon you want to tell the patient and confirm that our wheatgrass is a supportive care alone. It will utilize as a supportive care. It is not an alternate to the drug treatment. It is not alternate to the chemotherapy. It is not alternate to the radiation. You want to first of all clear the patient to them. Why means if you take the patient, they will not get any improvement. Means it will give the false hope to the patient, and it will also lead to the poor adherence rate. So initial discussion should be in a clear manner and detailed manner about the wheatgrass is a supportive medicine, and setting expectation. You want to tell the patient about how it will help during nausea and vomiting. So you, that is setting expectation. So patient may expect more. You want to give the detail, and this is that your wheatgrass role. You cannot completely cure the cancer. Likewise, you want to give that an ongoing support. If the patient have experienced anything, if the patient have developed any side effect, you want to give the ongoing support throughout their treatment. So that is the patient communication strategy. You want to give that patient. So future clinical trial design. So the in future clinical trial design, so there should be a lack of RCT. So there should be a more observational study alone. So add on to the observational study, phase 2 efficacy study is one of the important thing. So it is a single arm study. The single arm study is nothing but there is no control group. So based upon that, we can identify the primary endpoint, like we can identify the treatment response rate, how the symptom improved from while taking the wheatgrass for breast cancer. Likewise, we can take. So this single arm study is based upon while the patients are taking any one thing drug that fail to their first line treatment, they are going to second line, and they are taking as supportive wheatgrass as a supportive care. So how your result is showcasing that is the week to phase 2 efficacy study. And randomized control study, you may know we want to do more on randomized control study. The why means that then should be we can get the quality of data on that. On biomarker investigation, like with genomic profiling, protein profiling, you use based upon that we want to investigate the biomarker investigation based. So professional development need. So professional development, we want to educate ourselves. Medical education is very important. Apart from the drug, we want to know more about the pharmacognosy. What means the pharmacognosy is the study of herbal drug. We want to know about that and training about that, how it should be. We want to read the more research article, meta-analysis, systematic relief, systematic review on that. So it will give the again on medical education on that. So nursing, so giving nursing education. So doctor or clinical pharmacologist want to train the nurse how the wheatgrass education give to the patient, how want to monitoring while the patients are admitted in the hospital, how want to monitor that. Likewise, you want to give. And pharmacy expertization. So pharmacy expertization majorly used for in drug interaction. Why means they know about that. If you they if the patients are prescribing a lot of drugs through the pharmacy alone. So based upon the pharmacy expertise, if the anything vitamin likewise anticoagulant drugs are prescribing means, the pharmacy easily can notify and educate the person. So if you take this mean, this interaction should be happen. You want to that also indicate to the doctor to monitor the ENR level. Likewise, the pharmacy expectation also we need. So interdisciplinary collab is nothing but collab of all the one. So botanian, nutrition, nurses, clinical pharmacologists, doctor. Through this collaboration only we can achieve the great research on the herbal medicine. So key recommendation. So we mostly look onto the evidence-based approach alone. So wheatgrass is a supportive therapy in most hematological malignancies. So it will give the high treatment related to the toxicity better. Likewise, it will give the evidence-based support and quality assurance. So while we doing the research on that, main thing is we want to consider quality assurance and patient selection is the main thing. OE means we want to evaluate the patient performance. After that alone, you want to select the patient. So that is one of the concern. And monitoring protocol. So monitoring protocol, assessmenting of their blood, CBC count and LFT count, which will be used to identify any adverse event effect, any side effect arise. So that is a clinical practice recommendation. So clinical research priorities, likewise, before trial itself, before slide itself, you see, we want to do RCT trial, and we want to know about the mechanistic study on that molecular biology and binding, lipoprotein binding. Likewise, we want to know that. And long-term safety we need because we have lot of long-term study and health economic. We want to compare the health economic mostly on that, and it will also give the most result of cost benefit ratio about the patient. So this is the conclusion of the our study is. So wheatgrass have some quality of evidence which is deployed in the in herbal and nutraceutical product. And we are also seeing the what is the lack on the nutraceutical products. So most they have a good quality data on that. So this is a great example for that. If you are doing any research, it shows the great example on that. And clinical integration pathway also we see how to initial assessment, how to want to how we want to train the nursing, how we want to give the interdisciplinary collab. Likewise, we see on that. So this is the conclusion part of the our wheatgrass study. So you may get idea about what is wheatgrass in today's session if you got to listen on that means. So Wheatgrass is one of the great example in the nutraceutical product. So if you're doing any research on the nutraceutical, if you are doing any meta-analysis, any systematic review, means you go with wheatgrass. So it will give you to weightage to your paper also and weightage to your resume also. So thank you all.
Thank you, sir.
Thank you,
Uh,
ma'am.
there are a few questions. First
Yeah.
question, where there are any adverse effect or interaction reported when combining wheatgrass with conventional anti-cancer drugs?
Yeah. Till now, there should be a no report on that. If you see in the in slide itself, there should be a no official report. Why means we have a lack of in adverse event monitoring data. In drug, we have adverse eventing farm and reporting center, pharmacovigilance center. We may now we have lot on that. But in herbal product, there should be a lack on that. So it may be arise in some cases or in some area, but it is unnoticed that. So till now there is no official data published about related to drug interaction. But they some may study will they suggest suggestion will give likewise anticoagulant. You may know because the bioactive compound chlorophyll have a high K active compound, so it will interact the patient. Likewise, we have some data on that.
Okay, sir. Thank you. There are second question is, does wheatgrass modulate oxidative stress markers and antioxidant enzyme activity in tumor-bearing models?
Yeah, why means it have a immune modulating stress. So while we doing it is a great example for that. While we giving a radiation, the patient going for the radiation therapy or if they employing in radiation cancer level therapy means they have some may arise the oxidative stress. Oxidative stress may be arise. That should be in a limited manner. While well, it also overcome through that medication likewise. So wheatgrass oxidative stress marker also we can use for the wheatgrass. So it also play major role that whether the stress oxidative lesser is whether in high modulate. Likewise we can see on that. So antioxidant enzyme activity. Why I'm saying means it have in bioactive compound itself you know about it. It have a bio antioxidant enzyme activity on that. So it also very helpful for the tumor bearing model predictive model technology studies.
Okay, sir. Thank you, sir. Thank you so much. Thank you, sir, for the insightful session.
Thank you, ma'am. Thank you, ma'am.
Yeah.